Hi, everybody. Can you guys hear me? Can you guys hear me okay? Can you guys give me a thumbs up in the chat if you can hear me? I was hearing an echo of myself, so I think it's working. All right. All right, Jen says she can hear me. Hi, Jen. Hi, Raya. Thanks for letting me know about the link. I'm not sure why that was happening in the emails. Hopefully, people can join in because I had so much trouble getting that link to send. And this is my first time doing a live. I'm so excited to do it, but of course, there had to be some technical difficulties in the process of learning how to do this. So I see that there's a few people connected. I wanted to know who is here today. So if anyone wants to share in the chat where you're connecting from, and if you already have a baby, how old is your baby? And if you're expecting a baby, how far along are you? Uh, yeah, I'd just love to see who's here and what you guys want to learn about. It's a snowy day here, which is crazy. I don't know if you guys saw in my one of my emails I sent out that it snowed here for the first time in New England, and my 1-year-old daughter was going crazy when she woke up and saw that the outside was no longer green and everything was white and there was snow falling down, and she was just squealing. It was the cutest thing. All right, Dula from Durham, awesome. My babies are both really big now. Oh, that's awesome though. I'm so excited to have people here who are supporting people in lactation too. And Sharon's from the UK. Baby is 26 days old. Congratulations. All right. Well, people filter in. I have a whole list of questions that get asked in the comments on my YouTube channel. And I try to answer them all, but it's hard to keep up with them all. So I would be happy to jump in with just start going through a few of like the most common questions that get asked. But since you guys are all here and took the time to be live, I want to give you the opportunity to ask your questions. I just want to put a little disclaimer in that on this platform, I can't answer questions that are like one-to-one or very clinically involved, specific to your case, just in interest of privacy. And I would need to know a lot of background information about you and your baby sometimes to answer really specific questions. But everything else, general about lactation, pumping, milk supply, milk storage, yeah, that's all fair game. So I'm really excited to see what you guys want to know about. And Jen says connecting from Pennsylvania, 3 kids, 5, 2.5, and 1. 20 weeks into pregnancy. Yay! Experience mama here. All right, Lexi asked, does the tongue tie procedure work and will feeding be less painful? All right, that's an awesome question. And I get asked that a lot. The tongue tie procedure, we like to look at it as a process because it is a procedure, but it doesn't work overnight. When a tongue is revised because of a tongue tie, and for those of you who don't know what a tongue tie is, it's when the little string that we have that connects the tongue to the bottom of our mouth is tight in babies to the point where they can't move their tongue properly for lactation and for emptying the milk. It can cause pain for the parent, and it can cause a lot of symptoms in a baby. So, and they don't get milk out as efficiently. So a lot of times what we'll do is go under and have, a pediatrician, a pediatric dentist, or sometimes an ear, nose, and throat specialist would trim that to give the baby more ability to move their tongue. However, that trim doesn't work immediately. It takes a lot of work from other team members with working with lactation, sometimes body work, craniosacral therapy to get that tongue to work properly. So a lot of times, if you're working with a lactation consultant and it's determined that it's necessary to do the tongue tie procedure, it really can make a big difference in feeding, but it's not an overnight thing. It takes a lot of work and exercises and kind of teaching the baby to relearn to use their tongue with its newfound mobility. So kind of long answer to what seems like a simple question, but it's a great question. I always tell parents, if you're going into the procedure, to go in with the mindset that it's might get worse before it gets better, and it's going to take some work and some exercises to get you to a place where things are feeling better and working better. Yeah, you're welcome. Yeah, I actually went through, I don't know if I've shared much on my channel, but I went through the tongue tie procedure with my daughter, and it was seriously a huge eye opener because her latch, it took so long. It felt like it took so long for it to feel better, like several weeks, if not months, for us to get to a place where we're like, okay, now this is working. It was hard, but it's definitely worth it. Let's see. Is it easier the earlier the tongue tie revision happens? Is it ever too early to do? Yeah, it is easier if it gets done earlier because the baby doesn't have to relearn new habits once they've kind of learned how to move their tongue in a certain way. If the longer they go using their tongue with the tie, the longer it can take for the revision to work. So the sooner the better, but it really depends on the provider performing the revision. They may want a baby to be at a certain weight. If the baby's premature, they might not do the procedure. And we usually wait at least like a week or two after the baby's born to do it. And really, if we're noticing that early on that there's a tongue tie or another oral restriction, we might be trying some other things like body work or therapy prior to doing the procedure. And that's really the case with any time that we're thinking about a procedure. We want to be thinking about getting other therapy involved ahead of time, because like a body worker, for example, could release any tensions that the baby may have from delivery. If they're having some torticollis, which is when their head is kind of restricted and tipped to one side because of muscle tightness. And some of the other tightnesses can happen in the face, the jaw, and whole body really. And that can be a result of just like positioning in utero or, so it can, like, the sooner the better, but there's also some work that needs to be done before we jump in right away and get the tongue revised. Good questions. It's funny how tongue tie is like so prevalent in the lactation world now. So many questions and so many problems that families come to me for are related to tongue tie. It's really, really fascinating. And I don't know if it's really because tongue tie is more common now than it ever was before. I just think we're more aware of it and hopefully better trained in looking for it. Yeah, exactly right. Says, what did they do with babies that had tongue tied before they learned to do revisions? That's a great question. I think that way back in the day when people had more support and had the true village that it takes to raise babies. Probably there was more milk sharing going on, and wet nurses, and just helping parents get through those early struggles. And I'm sure a lot of parents and babies struggled before they were able to get revisions done. Anyone else who's on have some question they want to type in the chat? Okay, feel free to just chime in. I'm going to go through some of the questions that I have had come up on the channel. I guess one of the first ones is, how often do newborns eat, and how do I know if my baby's getting enough? That's one of the number one questions that I get asked. So newborns eat at least every 2 to 3 hours, but we really encourage them to eat on demand. So on demand means whenever a baby's showing early hunger cues, like sucking on their hands, sticking out their tongue, moving their head side to side, those kind of things. Those are when we want to feed the baby, even if it's hasn't been 2 to 3 hours since they ate. If it's only been like an hour, then we would go ahead and put the baby on, offer them food, and then they tend to eat about 8 to 12 times in a 24-hour period, but it could be more than that. So don't be surprised if we're seeing babies eat like 12 to 15 times initially, as they're like working on that lots of stimulation to get the milk to come in. Is very normal. So on demand, but we don't want a newborn to go more than 3 hours without eating. So this is where it gets a little tricky, because we've always been told, like, don't wake a sleeping baby, but when they're newborns and when they're getting exclusively human milk, they do need to eat at least every 3 hours. So we would encourage parents to wake the baby up, start to wake them up if they're still asleep at the 3-hour mark, and offer them some food. And then how do you know if your baby is getting enough to eat? We are always looking at their output. So how many wet and dirty diapers are they having? And the number that we expect differs from day to day. And we also want to see a full baby after they feed. So they should be nice and relaxed. We shouldn't be seeing any of those hunger cues anymore. The baby's hands will likely go from tight fists near their face, and they'll start to relax and just be like floppy and relaxed. And that's a good sign that the baby has gotten enough to eat. You should be hearing swallows while they're eating. And their weight is something that we monitor closely too. So initially, if you're delivering at a hospital, the hospital staff would be measuring your baby's weight, and then the pediatrician would monitor a baby's weight closely as well. Let's see, there are some questions popping up now. First time mom here, Genesis says, what changes and challenges should I expect as my baby's teeth come in? Oh my gosh, I'm going through this. My baby now has 5 teeth. I feel like every time a new tooth comes in, you're gonna feel it at first, and it feels a little bit uncomfortable for a couple of days. And then it's like, between you and your baby, you get used to it. So they're like learning how to adapt their latch with their new teeth. And all of a sudden, like, it might be a little painful as a new tooth comes in, and then they figure out how to latch right with their new teeth, and then it's not painful anymore. But one of the challenges is that some babies find it funny when they come off to like chomp a little bit, or usually when babies' teeth start to come in, they're also doing a little bit of those, what we call gymnastics, where they're latched and they're just like can't sit still, and they're moving around, and they're trying to stand up and flip over and get their toy and doing all kinds of crazy things. So they may try to take off on you before they even unlatch, and with teeth, that's really painful. And so one of the challenges is to try not to yelp or scream or anything when they come off, because some babies find that to be funny when they hear that noise, and then it may become a game for them. So I know that it's really hard to do. I have a hard time when it happens, not yelping. I mean, it's a natural response, but as much as you can, trying not to. And then if a baby bites down when they're actively feeding, if you just hug them in close, um, and kind of like squish their nose into you, then they have to let go because they need to let go to breathe. So instead of like trying to pull them back, and that's going to really hurt, just hug them in closer and they may just let go on their own. So those are some of the challenges that come up with teething. Let's see. Lactation consultant in our children's NICU recommended your channel. Oh, awesome, Joyce. That's awesome. I love that. Elijah says, I challenge you to do 100 squats. Woof. Couldn't do that right now. Definitely not. I'm a year postpartum, but definitely need to work on my fitness over here. How would you compare teething discomfort in the first days of breastfeeding? Because that was very painful for me. Baby had a hard time latching because the letdown was very strong. Oh, okay. It's different. The latching that happens when you're having latching issues in the beginning is constant, I think. When you're having latching issues in the beginning, that pain is like, it doesn't go away. It kind of lasts the whole feeding. Whereas when a baby bites down, it's so brief. They like bite down and usually let go, and it's like surprising, and it's similar like intensity of pain, but it doesn't last the whole feeding. So I guess that would be the major difference. But yeah, that beginning when you have a baby who's having trouble latching and you're having that discomfort, it's really tough. You're like, at least I was cringing through a lot of feeds for many months. All right. Let's see. So since someone mentioned, thank you, makes the list. Some idea what's coming next. I know. It's crazy like how much things change when you're on this journey. Like you figure one thing out and you're like, all right, my latch doesn't hurt anymore. And now we gear up for the teeth, and now we gear up for introducing solids. So it's a constantly changing road ahead of us. To reassure you, it was not bad for me when my kiddos were teething. Yeah, exactly. Not everyone has issues with teeth, and it's really not that bad for me either. It's just like once in a while you realize those teeth are there, but it's definitely not as bad as I thought it would be either. Since we had someone mention that they had a baby in the NICU, one of the questions that I do get asked too is, how is latching and lactation different for babies who are born either premature or like a late term premature baby? So when we have a baby in the NICU, for example, that could be a really different, it could look many different ways, because the baby might not be able to do any direct latching yet. And in that case, a lot of times we would have, or all the time when a baby isn't able to latch, we would want the parent to be using a hospital grade pump to pump every 3 hours for about 20 minutes. That is kind of to mimic that pattern of what the baby would be doing and stimulating the body to produce milk. So if we don't have a baby who's latching, we need to replace that stimulation with pumping. And it's important to use a hospital grade pump because that's the strongest pump that we can use to bring in a milk supply. And for babies who are born early or just a little bit early, even like 36, 37 weeks, we can see challenges with latching. Even if they are latching, they may have trouble emptying the milk out just because they're not quite strong enough yet. Babies develop a stronger suck as they get closer to full term because their cheeks start to fill in and they just get a little bit more coordinated with their suck, swallow, and breathing. So if there is a baby who's even like almost full term, but like 37 weeks, we can see some of those early challenges with milk emptying. So we have to be really keeping a close eye on those babies for good weight gain and good diapers, good output to make sure that they're getting enough. And if they're having trouble with getting the milk out, we usually would have the parent do some pumping to complement the latching and help empty the milk, protect the supply, and get a little extra milk into the baby. So for anyone who is dealing with or may end up dealing with the challenges that come along with having a baby born a little bit early, it just takes a little bit more tweaking to the plan in the beginning to protect the supply and get the baby fed. But as they get closer to full term, we see them start to improve in most cases. And if you're facing any of those challenges, working with a lactation consultant is a really good idea, just to help tweak that plan. All right. You guys feel free to type more stuff in the chat about what you want to know about. Another thing that people are super interested in on my channel has been nipple shields and asking questions about what to do with flatter or inverted nipples. And I'm just going to talk a little bit about the pros and cons of using a nipple shield and when we would use it. But a lot of times, and it's more common than anyone even realizes, I think, how many differences there are in nipples and how, so I have my little model here. This nipple is everted. It's pretty well everted, but it could be considered a little bit short. But a flat nipple would just be flush to the areola, and an inverted nipple would actually have an indent to like go in, and some inverted nipples are able to evert with stimulation and some just don't. Not everyone who has flat or inverted nipples needs to use a nipple shield, but sometimes it is a good tool. What we do like to do is give the baby a chance to try without it, because babies don't know any other nipples. They were born to the nipples that they were born to, and they will learn usually how to do it, but it can be challenging in the beginning because when the nipple touches the roof of a baby's mouth, they are stimulated to initiate sucking. So if the nipple isn't making contact with the roof of the baby's mouth, it can be challenging for them to initiate sucking. And some babies will, like, we have a saying that some babies will just suck paint off a wall. Like, some babies will suck no matter what, and some babies will not initiate a suck without that stimulation to the roof of their mouth. So for those of you who haven't seen a nipple shield before, this is what a nipple shield looks like. And it goes over the nipple to extend it and make it a little bit longer, so that it does touch the roof of the baby's mouth. And we put them on by kind of flipping them halfway inside out, if you can see, like that. And then you put the nipple in the middle, and then you stretch this base up and over the nipple. And the nipple should pop up into this little cone shape. When a baby latches, we don't want them to be sucking on the tip of this nipple. We want their jaw to still get really low down on kind of like the bottom edge of the areola and open wide and come up and over. And this piece should be landing close to the back of the baby's mouth, so it hits that palate. There are different sizes of nipple shields, so people should be checking in with their postpartum nurse or lactation consultant if they're needing a nipple shield about what size works for them. It's usually something that works for the baby's mouth and the parent's nipple size. Some of the pros to using that, like we just said, it can help when a baby's having difficulty latching because of shorter or inverted nipples. We do want to be cautious when we're using them, though, because they can cause a little bit less stimulation to the parent's body because it's a barrier between the nipple and the baby's mouth. So when we're using them, we might introduce some pumping to give the parent a little extra supply or little stimulation to protect their supply. And we want to plan for trying to wean from the shield. So the ideal is to only have to use it for a couple of weeks. And some people do end up using them long term and it works for them, but we always want to try if we can to help parents get them or stop using the shield after a couple of weeks if possible. And a lot of people want to stop using it too because it's hard to get it to stick on, and then when they're positioning the baby tends to knock it off, and then if they're out in public and want to feed their baby, they have to find this. It's a great tool when you need it, but it's also great if you don't end up needing it in the long term. And does anyone have any questions about nipple shields or anything else? Okay, let's see. A lot of people ask me, especially in my deep latch video, how do I get my baby to open their mouth wide? My baby won't open their mouth wide. And this is so common with newborns, especially newborns are just like sleepy in the beginning and tired and spitty and sometimes gaggy, especially the first couple of days. And then even after that, it can be really challenging to get a newborn to really open their mouth wide. So just kind of to walk through positioning for how to get a baby to open their mouth wide. What you want to do is, and it depends on the size of the areola, and I do get asked this too, like, how do I get a baby to latch to a larger areola? The entire areola may not fit in the baby's mouth, and that's fine. Sometimes it just doesn't. This is a smaller areola, so this would mostly fit in a baby's mouth, but some areolas are wider, and we just want to see the baby's chin hit like this far behind the nipple, at least like 1.5 inches, I would say, behind the nipple. So the chin would touch here, and then the nipple we want to point up towards the baby's nose and upper lip. And if you kind of drag that nipple like this from the baby's nose to their upper lip, they're going to start to smell the milk. You can give them a drop in their mouth, they'll taste it. And then because it's pointing up instead of right to their mouth, they have to lean back and open their mouth wide so they'll come up and over. And it's not going to happen immediately, so a lot of times you really have to like do that teasing and be patient and wait for the baby to really open. Another thing that you can do, I'm going to grab my baby doll. Another thing that can help get a baby to open wide is a lot of times parents are putting pressure on the back of a baby's head and bringing them in like this. And we want babies to kind of lean their head back so they're capable of opening their mouth wide. So when we hold the baby lower around their lower neck from ear to ear and have a palm on their shoulder blades, if we push and put more pressure behind the shoulder blades than on the head, it makes the baby naturally extend back. So like this. So when a baby extends back and the nipple is pointing up higher, they'll tend to open their mouth wider. All right, let's see if we have questions coming in. How long can I expect my nipples to be sore? I'm a first-time mom, baby born 10/15. Oh my goodness, your baby was just born. Congratulations. 10/15. Oh, okay, October. I was thinking November 15th, but still super new. Congratulations. Transitioned away from nipple shield after a week. Hey, congratulations. That's super hard. Started using reclining positions due to strong letdown. Yeah, reclining positions for strong letdown. Nipples, I mean, we don't want your nipples to be sore, and they might be sore. Like, it's normal for nipples to be sore when we're initiating lactation, usually for the first week or two. It's really normal for especially the first like 30 seconds of a latch for it to be painful. But your nipples, hopefully beyond the first week or two, won't continue to be sore after feeding. and they shouldn't continue to be sore well into a feeding. So if you're still feeling a lot of soreness, I would definitely work with a lactation consultant just to check your latch and see if there's something else going on, like if it's just a latch issue that needs to be fixed, or if maybe there's a possible tongue tie going on. So hopefully that will start to get better for you. But if you're like a month into it and you're still feeling a lot of soreness, definitely consider working with someone on that. All right. Yeah, of course, no problem. Other questions that I get asked a lot are about pumps and pump parts, and people are always confused about what needs to be washed and sterilized before using their pump. Basically, everything that touches milk needs to be washed every time that you pump. And every time I would wash and sterilize everything when you first get your pump. Except for the clear tubes. So if your pump has tubes that connect your bottle and your parts to the pump, then those tubes shouldn't be washed. Water can get stuck in there, moisture can get stuck in there, and then they can start to mold, and we want to avoid that. So they don't need to be washed. No milk should be touching those tubes. And anything else, like here, I'll show you this is a flange. Anything that's like hard plastic or the soft diaphragms, the duckbills, the flaps, depending on which pump you have, all of that should be washed every time that you use it and sterilized every couple of days at least, depending too. If you have a baby that's in the NICU, for example, you're probably going to be sterilizing a lot more frequently. So check in with the NICU on what their recommendations are for that. And then people ask a lot about the difference between pump settings. So not all pumps are the same, but some pumps have levels of suction and also the ability to change the cycle. And there's some confusion around the difference between the suction level and the cycle level. So the suction level is just how strong the pump is sucking. So it could be a light, gentle suck, which it usually is for like the initial stimulation or letdown phase. It's gentle. And then I always tell people to start in a low level and then work your way up on that suction. So it will get stronger, but it shouldn't be causing pain. The cycles so a lower number is a slower cycle. That just means how often the pump is sucking. So say like, I'm just going to throw numbers out there. Say a lower cycle of 38, I think it's 38 cycles per, I don't know how many seconds, but let's say 38 cycles per minute. And then a faster cycle of 70 would be 70 cycles per minute. So it's just how fast it's sucking, not the strength. It's more about the speed. Does that make sense? I feel like maybe I just made that more confusing, but hopefully not. Will the frequency of feeds decrease as the baby gets older? I have a newborn now that feeds all day. Yes, yeah, they do. They feed all day when they're newborns. And it does get less frequent as they get older. Babies' systems just get to be more mature. They can go longer without eating, and their stomach capacities grow, and they can eat more per feeding and not need to eat all the time. But newborns, yeah, just feel like they're feeding all the time. And then if you are planning on lactating past 6 months, you'll start to introduce solids after 6 months, and as babies like transition onto more solids, they eat less frequently milk. So that's all a process. But yeah, beginning with a newborn, it feels like you're constantly have your baby attached to you, or constantly feeding them one way or another. Is anyone are there any exclusive pumpers on the chat, or is everyone kind of do it. Let's see. Let's do a little code. Put an X in the chat if you're an exclusive pumper. Put an L if you're latching your baby, and put an M if you're doing kind of a mixed journey, whether that's pumping and latching or human milk and formula. Just curious to see who's here, what you're most interested in hearing about. Latching, all right. Things are coming in slowly. Let's see. Usually we end up being mixed, okay? Someone asked me, and I think this was a really good question. Someone asked me, how do you get your body to respond to a pump? Because sometimes our bodies are so used to responding to our baby's latching that it just isn't the same when we pump, and we don't get out as much as we probably even do when our babies are latching, because there's so much involved when a baby's latching with, their suck is completely different than a pump. And then you have all of the hormones, the oxytocin from having your baby there with you, and the feeling of them latching and their smell and all of those things. And babies are just more efficient than pumps anyway. So a lot of times what happens when people pump, especially like if they go back to work, they have trouble keeping up with the baby's needs because you just don't respond the same to a pump. And some things that people can try is like looking at a picture of your baby while you're pumping, having a baby blanket or a piece of their clothing that they've had with them and smelling that while you're pumping, listening to sounds or watching a video of your baby crying or just laughing, babbling. And then some other things that can help are like a little vibration. So there are like lactation massagers, they call them. So they vibrate a little, and you can use those while you're pumping. That can help kind of stimulate a letdown of milk, or just doing some hands-on pumping. So while you're pumping, doing some gentle massage towards the flange to help empty out the milk better. Those are all little tips that might help for someone who's not responding the way that they hope with a pump. It can be really tricky. All right. And then I get asked a lot about, does a baby have to burp after every feeding? Some babies don't. Some babies have trouble burping, but most babies will just burp like 1 or 2 little burps after they feed. And you can actively try to get your baby to burp. So like holding them here and doing like some firm pats behind their shoulder blades. But another thing that just seems to work with babies is position changes. So if the baby's laying down, like sitting them up, just kind of doing that a couple times to get that bubble to come up. I found that to work better with my daughter, at least. But some babies, like, you really need to massage their back and give them some firm pressure pats behind their shoulder blades. But sometimes just holding them upright for a little while, and that sometimes that's just enough to get them to burp. And then if your baby doesn't burp and they don't seem uncomfortable, it's fine. It's not the end of the world if they don't burp. Any tips for babies with reflux and gassy babies? Yeah, so there's a lot that could be causing gas and reflux, and we did talk about tongue tie. So tongue tie is definitely one thing to rule out with babies who are struggling with a lot of reflux or gas, because when babies swallow more air while they're feeding, they tend to have more reflux. So that would be one place that I would start to one thing that I would start to look for if someone's reporting that their baby is really gassy or having a lot of reflux. That's probably the first thing I would check is the latch, how much air they're taking in with the latch. If they're losing suction a lot while they're eating, they could be swallowing a lot of air. And then some pediatricians will recommend like gripe water or simethicone for gassy babies. And those can sometimes help, but I would want to be looking at a feeding to see if maybe there's something we can do to prevent the gas to start with. And then also when parents have like an oversupply of milk or too much milk, we can see really gassy babies just because they're like swallowing milk quickly, and they might be getting a lot of milk that has higher amounts of lactose in it and then having a hard time breaking it down. Sorry, this might be too much detail, but the sugar that's in milk can cause babies to have GI upset and gas if they're not breaking it down fast enough. And we can see that when parents have an oversupply, we might start to see their poops look green and bubbly or frothy. So oversupply, latching issues, tongue tie, those are places to start investigating if babies are really gassy. And then Leah says, how long should a feed take? Okay, so this is also going to depend, but for newborns, average, we want to see like 15 to 20 minutes. And I don't want to say per side, but you want to offer both sides at every feeding. So the baby might do like an active, and active feeding is when the jaw is like going up and down, baby's actively sucking, not like sleeping and hanging out while they're latched. So active feeding, we want them to be on one side, let them finish completely on that side. So you don't have to like, oh, it's been 15 minutes. Now I got to switch over and do 15 minutes on this side. We want to let them finish. So give them like even up to 25, maybe 30 minutes if they're still active and actively sucking and getting milk. And then if they stop before then and you can't get them to keep sucking, then you want to kind of take a little break, let the baby burp, and then offer them the second side. They may only take the second side for like 5 or 10 minutes or not at all if they're full, and then you would just start on that side next time. So sometimes feedings might take 15, 20 minutes. Sometimes they might take like 45. If feedings are always taking 45 minutes to an hour, every single feeding around the clock, that's too long, and you want to have someone taking a look at your baby's latch, at how they're transferring milk, and just like an overall picture of how feeding's going, because something might be off if they're taking that long to eat. So that's one thing to consider. And then as babies get older and more efficient at emptying out the milk, they might do quick feeds. So babies, or if the parent has a lot of milk and a fast letdown, the baby might get full faster than that 15 to 20 minutes. So it's always about looking for those satiety cues after they eat and making sure that they look full, that they're not showing hunger cues, that they're relaxed and they're not crying, that they seem just relaxed and sometimes milk drunk after feeding. So there's kind of a lot that goes into it, but that's a long-winded answer for how long feeding should take. All right. Let's see what else. What's the difference between being full and just falling asleep? Someone asked me. And kind of that just piggybacks off what I just said, that when a baby comes off, that they shouldn't be, but actually when newborns are really sleepy, they fall asleep a lot before feeding, while they're feeding. So it is hard to tell when they're full and when they're asleep, but we do want them to be doing some active feeding. If they get on and actively feed for a minute or two and then fall asleep, that wouldn't be considered an effective feeding. But if they were latched and fed for like a good 10 to 20 minutes and then seem full, fall asleep, then that would be a sign that they are full if you're not seeing the feeding cues anymore. And then the baby should stay satisfied for some time. I mean, obviously, like I said, feeds are spaced out in different amounts of time when we're doing on-demand feeding, but we shouldn't see a baby that wants to eat for 2 minutes, fall asleep, and then wake up again in 5 or 10 minutes and eat again for a minute or two and then fall asleep. That would be something to take a look at, even though newborns on the first day or two are really sleepy, and that is kind of the way that they eat. But after the first couple of days and once the milk starts to come in, we want to see babies be more active and really pulling the milk out and doing good stretches of active feeding before falling asleep. Okay, anything else? Anyone else have any questions? Questions, comments? Want to share anything with the community? Okay. Well, this was fun. I'm gonna have to do this more often. This was really fun. I'm gonna share with you guys in the chat. Let me grab it. So I have a class coming up next Wednesday. If you or anyone you know wants to learn more about pumping, let me copy it. Here we go. So I'm doing a class all about pumping, and it can be for anyone who's interested in exclusive pumping, but just anyone who wants to include pumping as part of their journey. And it's going to cover things like how to pick a pump and fitting flanges and protecting milk supply. And there's everything that you need to know going into pumping, work schedules. So I will share that. And for anyone who was live today, I'm also going to share a discount code with you, so you can get 10% off of that class if you want to participate. And then I'm also going to leave you the link for how to book virtual sessions with me if you or anyone you know or work with needs a little bit of extra support virtually with lactation or picking a pump or anything like that. Then they can book that through my website, and I'll copy all that to you guys now. All right, so there's a discount code for those of you who are live, and then I think it all kind of got crammed together, but there's the link for booking with me if anyone wants to book with me. And that pumping class is going to be live on a Zoom type platform, and it's going to be at 6:30 next Wednesday, 6:30 p.m. Eastern time for those of you who aren't on the East Coast. And I'm going to recopy the last link because it looks like it got crammed into the other words. And since we've already had so many issues, or I've already had so many issues with my links in the last couple of days, there we go. All right, everyone, thank you so much for hopping on today. This was really fun, and thanks for being here. And I look forward to talking with you all some more soon, I hope. Have a great day.